going to hit record right now, available for viewing later. Anyway, good morning. Welcome to NSA New England. This is our morning coffee hour, and we've got a double feature today. And Dr. Mache Siegel, a longtime member of NSA New England, has graciously offered to share with us his insights about our favorite topic of the day, Corona. And we're not talking about the beverage. We're talking about the global pandemic, which hopefully people are staying healthy and monitoring, but most importantly, following all of the guidelines. Anyway, I'm not the expert. Dr. Siegel is. So we will now turn this over. And Mache, thank you. We really appreciate this. It's a timely topic. And thank you for your offer to do this.
Well, it's my pleasure to offer this to our community because it couldn't be more timely or important. Who would believe that it was just 2 months ago when one man came back to the United States, citizen, from China and was diagnosed with COVID-19? It was just 2 months ago. As of yesterday, there were over 200,000 cases in the United States of COVID-19 and 1,000 deaths. So this is a really, really important topic. And some of you may know, I've been on the Harvard faculty for over 20 years and at Beth Israel Hospital. And now all of our emails coming in daily are totally consumed with the COVID-19 because it's changing so rapidly. I'm getting emails all the time. Here's the latest thing, here's the latest stuff, here's what's happening. And in addition, some of you may know that this last summer, I was ill and I had a stem cell transplant. Ooh. And I was in the hospital for a month. In July with that, afraid of any germ that could possibly be available. And so I was really crazy about germs. And now the whole world is. And so it's a very interesting thing for me to observe. When I was in the hospital, I wrote this little poem. There once was a boy who lived in a bubble in order to keep him from getting in trouble. But trouble came in through a crack in the floor because trouble does not need a window or door. And so today I want to talk with you about how to patch that crack up a little bit so that we can all stay out of trouble. So with that, I want to just jump right in and talk about what you need to know about COVID-19. So first of all, I've made some very high-tech slides. This is my first one. And so we're going to talk about what is it, what are the symptoms, how do you diagnose this, how do you get infected, how do you not get infected, the time frame of all this, and a few things that you can do to prepare. I want you to know I spared no expense for that slide. First of all, what is COVID-19? Well, COVID-19, the name itself stands for, the COVID is coronavirus, the D stands for disease, and the 19 stands for 2019. Every virus gets a name. Now, coronavirus is a class of viruses, and most of our flu is a variety of coronavirus. And if you remember back in 2003, there was the SARS epidemic, and SARS is severe acute respiratory syndrome. And then a few years later, we had MERS, which is Middle Eastern respiratory syndrome that came from Saudi Arabia. And it turns out that the SARS virus and the coronavirus share about 80 or 85% of the same kind of genetic material. So they are, in fact, very similar, but very different. So what makes Corona interesting is that none of us in the world prior to this virus ever had it before. they call it a novel virus. You keep hearing that word novel. So we don't have any immunity to it. And so it turns out it's a little bit more virulent than the SARS virus, and it also turns out it's a little more infectious than the SARS virus. So it's a bad actor. And it probably came originally from bats, from animals. There are a lot of viruses in animals that we don't get, but it's a respiratory type of virus. In China, in these little markets, I don't know if they eat them or what they do with them, but they sell them in markets. They have cages stacked up, and these viruses are breathing out. People go by in very tightly packed places, and somebody got it, and then that started the whole pandemic. So that's the what is it part. So what are the symptoms? There are a lot of symptoms with it. It is kind of interesting. The symptoms include fever, cough, sore throat. SOB is shortness of breath, unusual fatigue, and it can be intense fatigue, chills, body aches that can be quite intense. You feel like you're getting crushed. And those are really kind of the flu symptoms, but intense flu symptoms. Then there's a lot of GI symptoms. There's vomiting, there is diarrhea, nausea, and abdominal pain. So a lot of GI symptoms. And then this unusual thing, anosmia. Anosmia just means that you can't smell. And so I've heard people tell me that they were cooking onions and garlic in the frying pan, and they just don't smell any of it. So it's a peculiar thing. So the next thing is what is about the symptoms. I want to just point out before I forget, they've just reported this morning, they just had a report that said that a large number of people have no symptoms and are able to spread the virus 1 to 3 days before they ever get any symptoms. So if you're walking down the street, this is what makes it so bad. If you're walking down the street and somebody says, I don't have any symptoms, that doesn't mean they don't have the virus. 1 to 3 days before they have any symptoms, they could be spreading the disease. And we know that a minimum of 25% of people have no symptoms at all. They're just asymptomatic. So how do you diagnose it? Well, the diagnosis is made by one of a few ways. The one you hear about most commonly is the nasal swabs. They have like a very small Q-tip. There's a special swab for doing nasal swabs. It's very small, has a long stick on it, and they put it in the nose as far back as they can get. I've had them done to me, and it feels like they're sticking it in your brain. It goes way in, but they put it in, get cells out. Some of them now are putting it down the throat. And they've just now done a study through the Gates Foundation that shows that people can self-swab and get a good result, about as good as if the healthcare professionals putting it far up into the nasal passage. And so they then will take that little swab and put it into a little, like a test tube. And the test tube has some fluid, some reagents in it. And the reagents break down the cells from the nasal pharynx, wherever they got it, and release the genetic material. And then a little bit of that genetic material is then put into what they call a PCR machine, a polymerase chain reaction, which is just a fancy name for something that will analyze the molecular structure of whatever genetic material you throw in there. And that will allow it to be analyzed, and they can say they have coronavirus or COVID-19. Now, the other way is by something called serology. Once you get an infection, your body will try to fight it off and make an antibody. And these antibodies are called IgM and IgA, IgG. These are the ones. So the ones that go up in this situation, mostly IgG and IgM. And so if you have that blood test and you come back with that, that doesn't say you have the virus. That says you had the virus. So it says my body has seen this before. Now, what's interesting about this is that if you have a high enough level in your body of these antibodies, not only does it diagnose you as a person who has had it, doesn't mean you're a carrier or you have it active, but if you had it and had this body reaction to it, your serum could be spun out, taken out, spun down, and that antibody could be given to someone over here who is actually sick with it. And it might help them to fight it off. So that's something that they're starting to do now. Now, the tests in these things have in the past for COVID-19 have not been as great as good as you would think. You think you'd get a test and that would be that. But it turns out that a lot of the tests have 30% false negatives. 30%. That means it's a 70% chance of getting the diagnosis correct if you have it. And for that reason, let's just say you just had a baby and you wanted to see if you could hold your baby. They would get one test one day and then they would get another one the next day to make sure that it was really negative, because it could turn positive. And a lot of that isn't because the test is terrible, it's because it isn't sensitive enough and people have to get a titer going up. Maybe you're a healthcare worker and you want to go back to work, or whatever the situation is. They would get 2 tests in order to prove you a negative. The other thing is that there's a new test by Abbott that just came out about 2 days ago, and that test is going to be a doctor's office test. See, these other tests, you have to get the swab and send it off to a laboratory. And it can take 3, 5, whatever number of days. And this test can be run in a matter of minutes. They take the swab, and then the machine's about the size of a toaster. And with that little machine in between, and it can go in a doctor's office or an emergency room or an ambulance or wherever, and then they can then put there's a little opening, they stick that little swab into the opening, and they're able to get a result in 1 to 5 minutes. So in 5 minutes. And then if it's negative, they have to wait all the way out to 13 minutes. So that's pretty important. And that's going to be available now. The problem with the whole issue with the COVID-19 is that they haven't been able to get tests. As a matter of fact, they were talking about they had the task force, and they were talking about anybody can get a test anytime they want it. That is wrong. They cannot. As a matter of fact, right now, I just heard yesterday that Quest Labs has a backlog of 160,000 tests that they can't run because they don't have all the reagents. So there's no efficiency of getting it done, even if you get it done. And a lot of people can't get it done. My daughter went in to get her test done because she was coughing and she was achy, couldn't get a test, can't get it. So the next thing is, how do you get infected? Well, you get infected either by air surfaces, and that's by breathing, or by coughing or sneezing into the air and somebody gets the droplets, or you can get it where those droplets settle on a surface. And the surface can be like metal, and metal things last for 5 days, like doorknobs or jewelry or silverware. Those droplets stick around on hard surfaces like metal and glass for about up to 5 days. On wood, they stay for about 4 days, like furniture or decking and things like that. Plastics, they stay for 2 to 3 days, like milk containers, detergent bottles, bus seats, elevator buttons. That's a bad spot, elevator buttons. You got to be careful about elevator buttons. Anybody's been in the hospital elevator or anywhere, touches that button and you touch it, then you get it, and then you put it into your eyes, your mouth, or your nose, and then you can catch it. And because of that, even paper. So if you come from the grocery store and you come home, the paper bag, all the items in it, because look, you know, when you go in the grocery store, you might feel an apple to see if it's good. You might check out, pick it up and look and see, how much fat or something is in it. People are touching everything. So when you come home, you're supposed to wipe off your countertop, divide it mentally in half. You put the bag on one half, and then you take the stuff out and you get your well-saturated disinfected paper towel or whatever it is, and you wipe off the outside of the container and put it on the other side. You take out the milk, you do the same thing. If you have fruits, you can put it into the sink. You can put a little soapy water and wash them off. I know this all sounds crazy, but I'm telling you what you have to do if you really want to get rid of all this stuff. It's the perfect disease for somebody who's OCD. It's like, that's what it is. Anyway, so there's a whole ritual. If you get something from Amazon, it comes in the mail, that cardboard can carry for, a day or so. When we get the mail, it comes in a little slot. I don't open the mail for a day. I just leave it on the floor for a day. If you are going to open anything, you've got to go and disinfect afterwards. All right, the next thing is, how can you protect yourself? There is no vaccine. They keep saying there's going to be a vaccine, before long. It takes about 18 months to get a vaccine made. There probably won't be a vaccine until next summer. If there is, then that's going to be remarkable. The reason is because in order to make a vaccine, many times they take a live virus, they try to make it weaker, and they try and give a weakened virus to the person. And if by some chance that weakened virus likes the environment of a human and it starts to grow, giving a vaccine could infect them. And until they run the trials and there's 3 phases to doing a trial. One is to see if it's safe. A second one to see if it seems to be effective in the small number, and then they do it in a large number of people, thousands of people. So it takes months and months and months to do it at a very fast clip. So I don't think we'll have it soon. Right now, there are no medicines for it. They're talking about chloroquine and some hydroxychloroquine, some other things, a malarial drug. But some people are trying to take things in their own hand. There's another hydroxychloroquine that's a different form of it. That's for either plant food or some other issue. They're taking it at home. They've had several deaths from this. Don't treat yourself, only get the FDA stuff. And there's a lot of other medicines. I don't have time. I can't go into all that. But they're working on it. But right now there isn't any. So the whole thing is prevention, social distancing, and then there is the washing of the hands, and then face masks. There's a lot of talk about face masks. Mask, no mask. I'm telling you, people, you should wear a mask. The whole country should be wearing a mask. As I said, you can start that disease 1 to 3 days before getting diagnosed or having any symptoms, so anybody can have it. There are a lot of masks, and I want to say, before you put your mask on, you have to put some Perel or wash your hands. And I'm just doing this just for modeling, and you want to get it into your fingers and so forth, like this. And then there are several kinds of masks. There's the surgical mask, like this. These little yellow or blue ones you see. They used to think maybe they weren't good, but I'm telling you, these are good because number one, if you have something, you won't be blowing it out. And if somebody else has something, it will keep out at least the droplets, some of them. It's not airtight. There's another kind that's these N15s you keep hearing about. These have a filter on the inside of them. There's also some that have that filter as the whole mask. And they have to be snug around your nose, and you want them tight around your face so that air isn't getting in. And then there's a whole nother one that actually are very effective, but these are used usually by people like who do work and have mold, or they do tear down houses, and there's all this kind of stuff. I actually bought this at Home Depot. And understand, I had to worry about all this stuff because of my immune condition. If you want to be really careful, I have goggles, and you have them in a plastic bag after you open them. And then the goggles are not like the ski goggles, which have a vent in the bottom. These are non-vented goggles, so that they make a real seal and air isn't coming into your eyes, because eyes are a real source of infection. Finally, so that's basically how do you protect yourself. The time frame is going to be a while before this happens. And I just want to show you something that kind of blew my mind. This is why we have to be so careful. I just wrote these numbers. They look like not much here, but let me tell you what it is. This is one person, the guy from China, who comes in and gets infected. He infects about 2 or 3 other people, so it's 3 people. Now everything else is just doubling. I don't know if you can see this, but I'm just times 2. I just go right down the page and double these numbers. One guy, I'm doubling the numbers. There's 10 of these here, 10 lines. So this is, if you figure it doubles, that's what exponential growth is. You keep hearing about an exponential growth. So if it doubles every 3 days, this 10 lines is a month. 3 times 10 is 30. It goes from 1 to 500 people by just doubling every 3 days. But if you do another 30 days, it goes from 500 to 500,000 people. And if you go another 24 days, and I just stopped there, so we're less than 3 months, you're up to 148 million people just by doubling that one little number every day. Not every day, but every doubling time. So you're talking about, now if 20% of those people get sick, that means that's 30 million people. 150 million, 20% is 30 million people. And if 1% dies, that's 300,000 people. This is why I'm talking to you. It's sobering. It's sobering. And what happens is, if all of these people get sick at once, just let it rip, then you get what's called this surge, and everybody gets sick. And then this black line is the line that the hospital beds and capacity, that's all they can handle. And right now, New York is like this. If you can get people to social distance, if you can get people to wash their hands, if you can get people to isolate, then the curve goes like this dotted line, and the beds in the state can handle it. Right now, the USA peak is scheduled for April the 16th of 2020, just in about 2 weeks. The beds needed are 260,000 beds, but the shortage is 84,000 hospital beds in the United States. The ICU beds, there's 38,000 beds that are what we have, and we're short about 18,000 beds. In incubators, you can see we're 31,000 incubators short. All of this is the supply chain and management fiasco. In Massachusetts, the peak is for this is the nation. In Massachusetts, the peak is 416. And you can see that we have the number of beds needed is we need 9,000 beds, and we have about half of those. We're about 4,000 beds short. ICU beds, we need 1,435, and we're 1,100 short.
Jesus.
And the number of ventilators, we're 1,100 short. Now, Bob Kraft just got here with, he sent the Patriots airplane over to China. He came back with 1 million of these masks. He dropped off 300,000 in New York, and the rest will come to Massachusetts. So people are trying to help in whatever way they can. So we live a life in quarantine. So I want to just stop. I'll just say that my life in quarantine, I just wrote this little poem. It says, on Monday, I turned on my car just to park it on the street. Tuesday, cleaned the closet. Oh my goodness, is it neat? Wednesday, binged on Netflix. Thursday, cooked a stew. Friday, made a schedule, because there is so much to do. So here we are in this crazy time, but I want to open it to questions because we have a finite amount of time, and I want to see if this jars a question.
What's the humorous part of this, Mache? I thought we were going to have a funny routine here.
You know, I wanted to make it funny. In 20 minutes, I couldn't. And I will tell you, Steve, the funny part is that we didn't realize it was coming and organize. That's the problem. We need supply chain management in the whole scenario here because there's no distribution of stuff. That's the problem. But there's nothing funny about it, unfortunately. It's a somber thing. If I had more time, I could incorporate a wash your hands song and a few other things, but but it's tough.
Thank you.
The thing is that if everybody does what they're supposed to, it will end quicker. By July, this could be over the peak and starting to decline. But if everybody runs around and keeps going and infects, then it's just going to keep sustaining. What happens is that some countries where they isolated got through it quicker. And the ones where if they wore a mask, if the population wore a mask, even one of these masks, they got through it quicker. But if they didn't, it went longer.
I have a question about food.
Yep.
Yesterday I bought I was desperate for some produce. I bought some romaine lettuce and I bought some broccoli. It's very sobering what you talked about the food. Now the broccoli I cooked. I don't know if cooking cleans it up. It's got all those little tiny things all over it. And lettuce, what do you do about lettuce?
I'm not eating any fresh produce right now. Like you know, if it comes sealed and you keep it for I don't know how many days. I would have to look that up. If you keep it for a few days, it should. Now, if it comes in a bag and you wipe off the outer plastic, hopefully the inside of it, you know, will be clear.
This wasn't that. This was just a head of romaine I picked up.
I don't know the answer to that.
Okay.
I'll look into it.
Okay, thanks.
Mace, how does this actually go away? One of my concerns is it's under control and then everyone goes back to normal. And I'm sure there's going to be an infected person or two going out early. How does this like not come back, like in waves?
Well, it will come back in waves, but it will not be as big a wave. And here's why it doesn't come back ultimately. The first is that after a certain amount of time, there's a lot of people that have immunity. And because they have immunity, they're not being vectors to hand it to others. The second is that we'll have a vaccine at some point. And when we have a vaccine, then we can prevent people from ever getting it. So it's only in that. The problem comes with the waves is that we're not isolated. So it's just starting to happen in, say, South America and Africa. So traveling from other parts of the world can bring it back to other parts of the world. And then that can reinfect. But as more of the population gets it in the vaccines, that's what's going to really do it. And what we have to do is be able to get the disease down low enough so that people can then be identified and then they can be isolated and then their contacts can be traced and they can be isolated. And when that happens, but we have to get the number down so we can, that's what should have happened with the guy that first came in. And this could have been avoided, and not entirely. You can't stop something like this, but you can contain it. But yes.
Mace, I just, can you hear me?
Yes, I can.
Okay, perfect. It didn't go to me. So my niche is real estate, but my background is the health sciences. All right.
Mm-hmm.
So not only was I in as a dental hygienist, my mom was an anesthetist who actually specialized in their certifications. So all the sterile technique and that. And I don't know if you've been following, but real estate has been fighting very hard to become an essential worker, which here in Massachusetts they did achieve, unfortunately, I think. So I'm out there doing a lot of virtual training, but I see a lot of real estate agents gently swiping a quote unquote disinfectant wipe over a handle. And how do I teach them what they really need to be doing, and what are some things I need to tell them that they aren't doing correctly or aren't helping the situation?
Well, I don't know the details of what happens, but I would say that they have to keep a distance from the people they're showing with. I think they should all be wearing face masks and gloves, the little nitrile gloves that you can buy. I think that they have to really swab down the doors, and people shouldn't be, the people should be wearing gloves and even goggles if they want to be really, it depends on how fastidious they want to be. But they shouldn't be touching the stuff. They should be wiped, particularly the doorknobs, but whatever they touch. So if they're going to be the chairs, everything contains stuff potentially from the last people who were in, if it's been less than 3 days. So it's important to, you just have to think, what do people touch? And that has to be cleaned. And it's not a light thing. I mean, it's hard to buy disinfectant. I wanted to buy alcohol. You can't buy alcohol. If you could buy alcohol and you could get aloe vera, or you could maybe get some kind of a vegetable type of glycerin or something, you could make Purell. It's not very complicated, but you can't buy anything. There's nothing. So you just have to wipe off with soap and water or whatever disinfectant. You can use Clorox. You can just put a half a cup of Clorox in a gallon of water. You can make a disinfectant, but you just have to wipe down everything you come in contact with.
And aren't I correct from my own training is that, like, you would have to get a doorknob wet and wet enough to stay wet for, and I thought I recalled 10 minutes for it truly to disinfect.
I don't know about 10 minutes, but you're supposed to let it air dry. That's what they say.
Okay, so you do need to get it wet.
Well, if you have a dried out rag, it should be moist. It should be very wet, the rag that you use, whatever towel you use.
Okay. Thank you.
Mm-hmm. Anybody saying? I can't hear.
Yeah. What is the blunt question is, who's dying from this? Is it the old and the people with weakened conditions? Thank
you for bringing that up. If you're over 60, that is puts you at risk, particularly if you have an underlying condition. Underlying conditions includes things like even obesity, which is a condition, diabetes, heart disease, kidney disease, asthma, those kinds of underlying conditions, immune suppression. I mean, some of my antibodies are not 100% yet. They're getting there, and they will get there, but I just haven't had enough time to get them back. There's a lot of people out there, or like these drugs you see on television that are for like rheumatoid arthritis and so forth. And the guy says, and it can cause blah, 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 blah. One of those is immune suppression in a lot of these medicines. So you have to be sure about that. But young people are not immune to this. They get a milder case, but not all the time. There's friends of mine I know who have children who have, or as a guy who's 42, he's a surgeon. He's in intensive care right now. He got coronavirus. There are people that are, somebody 32, I think, died today in Massachusetts. In Chicago, there was a baby who was under a year that died of coronavirus, though children are generally immune. So the kids that vape, big risk because their lungs are messed up. Bad asthma, big problem. So it's a respiratory problem. So if you're a smoker and you have emphysema or you have that kind of lung issues because you've been smoking, if you're in your 30s or 40s, you'd be at increased risk. So incrementally with age, but not exclusively. There was a man, 102, that got this. He survived it. So just because you're older doesn't mean you're going to die. But what's going to be the problem is if they have these surges and there's not any ventilators and there's not enough beds, then people are going to get into some very big moral decisions about who gets the ventilator. That scares the hell out of me because, you know, it gets down to a very awkward question. And people are not prepared for that. Plus, you have the, you know, there's PTSD in the healthcare system. I mean, every day people are dying and so forth. So I really sorry to have to talk about, you know, Steve's asking, where's the humor in this? And I wish I could come up with a funny way to present it. And I'm sorry to have to be the bearer of this. But I think forewarned is forearmed. And I think the more you understand it is a serious thing, but you can take steps. We're not helpless. We can take precautions. That's the main thing. Be empowered. You know, people may laugh if you wear a mask, people may give you, but pretty soon they'll all have them. And the CDC has waffled a lot. The problem is that they don't want the mask taken from the healthcare, so they say the public shouldn't wear it. Whereas there information coming in that shows that societies that where the public wears masks, they have a quicker recovery. So everybody should be wearing at least one of these. You know, they just should. And gloves if you're going into stores and stuff like that.
Can a mask like that be used more than once?
The thing is this: you should Purell or wash your hands before you put it on, and you should Purell or wash your hands before you take it off. Because if your hands get anything on it and you get on the inside, you're sticking your nose right into the disease. So that's why people, they're part of it is they're afraid that the public may not be fastidious enough. But you do have to do that because otherwise you risk contaminating the mask. If you do it carefully, you can. These masks can be worn several times. The N15 mask can be worn several times, but they have a lifetime on it for the material. That's why you change the filters and so forth.
And any, I've got lots of questions. Anybody else? Questions?
Yes.
Mache, why do you think Japan was able to control this more so than any other country? What did they do differently?
Well, once they got on it, they jumped on it. In Japan, if you go to Japan, you'll see that they routinely wear masks. Anybody has a cold in Japan is wearing a mask and gloves often. And I think that they traced all of the people. If you had a contact, they traced everybody back because you're not only the person, but the person who's in contact with you. So that's how I think they did it.
Mache, what about all the people that are out there making homemade masks? I mean, years ago, we would have laughed at that anyone would have worn them, never mind a health profession. But do they have some protection to them?
They have some, you know, the deal is how porous is the material. This is more porous than the other. I would have laughed at it myself a month ago. But the difference between, you know, it's like having kids. You're a parent if you have a kid. So the difference is between none and one, you know, between some and some more is not necessarily, you know, increments then. So whatever it is that you put on is going to be helpful, much better than nothing. So I think they're helpful, but not perfect.
Thanks for that. I actually sewed a mask. My daughter has to go to work. She works at an animal hospital. She asked me to make a mask, and she found a pattern for me that has a pocket. And in the pocket, you put part of a filter that's a part of a vacuum cleaner bag, so you can change that out.
Interesting.
Is that a little more helpful?
I would imagine it is that, you know, I would think it would be. I don't know which filter it is, but I would assume it would be.
Okay, I'm happy to share that URL. It's a little clunky to make, but so it has 3 layers of fabric, and then you can swap out this filter.
That's very interesting. Thank you.
Mache, what is your recommendation for people that are normally scheduled to come into your office or your home? Like, for example, my bookkeeper comes in every 2 weeks. She went down to Florida. She's coming back. I'm like, okay, you coming to my house now? And my son's going to move back. And I said, hey, it's a whole new world, my friend. And he goes, Dad, I know, I'm an adult now. So, I mean, what do we do? We can't control those variables. Or we can't. I can say you can't come in.
I would do it virtually. that
Yeah.
you thought you could. I mean, I ain't going out, and ain't nobody coming in my house. I mean, that's just, I have a particular concern, but I think, you know, it's, we had a guy put on, we had to have a roof put on. The roofer was here. They were on the roof, but they weren't in the door. I just, you know, I kept them outside. We talked through the window. I mean, now I may be more conservative than some, but if she's been to Florida or he's been to Florida and everything, I wouldn't have them coming in my house because I just wouldn't. I would just do it virtually. And as far as your son, if you have any thoughts about it, any symptoms or anything, I mean, if you want to be conservative, then your son should quarantine for 14 days and then come in. He's not going to get a test. I'll tell you that. You cannot get a test. That may change, but you can't get a test today. And that's what I would do.
Thank you. Got a
Mace, another quick question. You mentioned that people with diabetes are at high risk. Why is that? I understand with people with breathing problems or heart problems, but what is it about diabetes that puts them in that category?
Well, diabetes carries with it a risk of vascular disease, which can increase kidney disease and heart disease. I mean, people with diabetes as an adult, if they've had it for a while, or have the same risk of, say, a heart attack as a person who's already had one heart attack having a second one, for instance, and kidney disease and so forth. So it's a systemic illness because it affects different parts of your body. So I would imagine it's because of the effect of diabetes over time on the organs of the body.
Thank you.
I think we have time for one more question. Anybody else? Mace, we certainly appreciate this. It is sobering. It's good to know the facts, though, and what we need to be doing.
Well, thank you for allowing me to share this. It was something I felt I could do for NSA and for the people. And I think the more we get information out, the safer we all become.
Oh, hi, Mitch. It's Carol Ann.
Hi, Carolyn. How are you?
Incognito.
Yeah.
What would you say for someone who has an elder in a nursing home?
Yeah, I have, my mother is in assisted living and they have put an embargo on anybody going in. You just can't, I can't go visit her.
Yeah, I had the same thing. And then they found COVID in the building and she had a temperature yesterday and the National Guard's coming in today to test everyone. It's total chaos.
That's a very tough place because you have people who are the most vulnerable.
Exactly.
And you have them in close proximity to each other, and at least they're coming in to test, so that's good.
And I assume they're just, you know, these poor elders that, you know, they're not the priority and they're going to be stayed there. They're not sending them to a hospital, that's just going to be it. You know, that's what I assumed.
Well, I make no assumptions on anything. I would only say that get out your advocate shoes and wear them, because you're going to have to be an advocate for that person, for your mom, because people are overwhelmed in the system, but she is entitled to the same thing. And there's a lot of lawsuits now going on about discrimination against people for being older or being this or that, and they should. Every life is valuable.
Right. Yeah. That's why I wasn't talking. I don't want to be sad.
Well, I've really
challenge,
been
a
cheering
challenge
everyone
is,
up.
yeah, I know. Like I said, it's almost surreal. A challenge is she has do not transfer to the hospital. So I figured, well, you know, this is how life is. So
you're going to be around sick people, which they're going to be in the nursing home. You might as well be around sick people where there's somebody who might be able to help her.
yeah, that's what I think. They're loving there. So, okay, thank you. I'm waiting for the mirth with Steve.
Yeah, so originally this, Elizabeth, our president, put together this series of chats, and we thank her for that. The original topic was going to be on the, finding the funny. Mache offered in a very timely fashion to contribute, and we felt, given the nature of the virus and what we can do to implement some things to actually have an impact on ourselves and others, we felt we wanted to bring him in. This, I think, was a good discussion. It took really the whole 45 minutes. So we'll save the chuckles for another time, I think.
You don't have anything to humor us, Roger?
Well,
Come on, Steve, you're funny. Come on.
I just think there, and I'm sorry for all the tragedy. This is an awful time. That I am seeing some good things. Families out walking together, eating dinner together, at a safe distance. People relaxing, realizing what's important. But there is humor everywhere. Just as an example, I was on a mastermind call last week, and Eric Bloom, I think I can talk about this. It was funny. He was trying out some new headphones, the kind an anchor on TV would wear, where the cord goes behind, because Tamsin Webster had said, "Hey, you got to try these." So he had them on, but he had strung the wire through his shirt, and then his wife, off camera, came to the door and said, "Hey, Eric, I need you for something." And we didn't hear her say that, but he said to us, the rest of us on the call, this is what was funny. He said, well, hopefully funny. He said, "Excuse me, my wife needs me right away." And then he stood up and took his shirt off and then walked off camera.
Dang.
So
Lucky him.
I'll give you one thing. I wrote this little poem. It's called No TP.
Mhm.
I had a problem. You might too. No toilet paper when I have to poo. The shelves are empty. The stores have none. What do I do when I am done? I called 911. What did they say? I cannot bring it. Buy a bidet. I bought a bidet to make use of its spout. The things you'll do when TP runs out.
what? Mic drop, shebang.
So,
Thank
Good
you.
job. Good
Hey,
job.
thank
hey,
you.
Roger, just one suggestion for everybody. If everybody doesn't read Andy Borowitz, which is from the New Yorker, which is being posted free, the guy is the most hysterical
He's funny.
satirist around. The guy writes, 4 short paragraphs. Today's story is Trump practicing distancing from all his prior statements about the coronavirus.
Great.
Every day he somehow finds humor in all this disgusting stuff.
That's great. Love it.
Andy
Anybody else?
Borowitz, check it
Something
out,
funny?
folks. We all need a laugh.
Have you guys seen the YouTube video of a couple dressed in black in their apartment imitating riding a horse?
No.
Oh, yes. Yeah.
It's
The guy bends forward and the woman rides off. No, she drops forward. She goes down and her hair becomes the tail.
and a horse with no name is playing. It's really funny.
There's another video series that's done by the Singing Dentist on YouTube, and he wrote a song that's based on Ice Ice Baby. It's Virus Virus Baby, and it's hilarious.
The Singing Dentist, great.
The
Love
Singing
it.
Dentist.
The Singing Dentist.
Singing Dentist.
Yeah, great.
Hey, Mace, thanks so much. Thanks, Roger.
Yeah, Mage, thank
Thank
you.
you both.
Thank
Thank
you
you.
all. This was terrific. Take
Only
care,
watch
be well.
comedy at night. Turn the bad news off.
I agree.
Yeah, really.
Yeah.
Take care, everybody.
All right,
Okay.
Mage,
Thank you so much.
You were helpful. Giddy up.